Thank you so much, Mr. Mark. My name is Mahmoud Radwan. I am a physician and consultant in sports medicine. I am an Egyptian and former national handball player play for Egypt senior handball team. It's my pleasure to be with you today to present a very important topic in sports, which is fatigue and recovery. Recovery, that is the name of the game. Whoever recover the fastest does the best because recovery is very important in sports. And recovery simply means to come back to the condition which was before training, so you can gather your strength and your stamina to start the next exercise. The hardest thing for an athlete, professional athlete, to do is not to train. It's very difficult for a professional athlete to tell him, oh, you cannot simply train because you are fatigued or you are tired or you are worn out. For an athlete to sit still, this is really a big problem, and a big issue for him because he will feel like he's not out there to practice sports. There is a very fine line between being a world champion and also a run athlete. Not every runner will be a real champion. And the key question is how can you push yourself to the limits of performance without tipping over the edge? I mean, without falling away, you know? So, how can you train hard without falling apart? How can you train hard without feeling that you are extremely tired? You cannot train anymore. You cannot perform the way you are used to. And the answer is one of the simplest yet most neglected training principles is recovery. By saying that, I mean that most of the professional athletes at some stage they ignore the fact that recovery is very vital for their performance and it's very important. And that's why we're going to go through the details of fatigue and recovery and how can we enhance our performance in sports. Recovery from fatigue is vital in sports, you know. The onset and the rate of fatigue varies depending on the type of activity. Yeah. It depends on the what kind of activity the athlete is involved with, okay? And it depends on the muscle fibers being used. Is muscle fibers like fast twitchers or slow twitchers being involved, like in sprinters, 100-meter sprinters or long distance runners? What kind of muscle fibers will be much involved in such an event? And this will affect the degree and extent of fatigue in athlete performance. Also, the types of muscle contractions, whether it's not, there's a lot of isotonic, isometric, or isokinetic contractions. This will also affect the kind of fatigue any professional player or even an amateur will experience during his training session. Intensity and duration of activity as well. It affects your stamina, your muscle power, your physical fitness, and whether or not you will be able to continue training at the maximum being a target for you to reach your goals. And it depends on your fitness level as well. We're going to talk about the types of fatigue, what kind of fatigue an athlete might express. There is local fatigue and general fatigue and long-term chronic fatigue. The local fatigue is localized, related to a specific activity. For example, due to hydrogen ion accumulations, soreness from lunges, what we call it delayed onset muscle soreness, which is a kind of pain an athlete will express after 12 hours after finishing his training. And this kind of delayed onset muscle soreness might continue up to 24 to 72 hours from the onset of finishing his training. Okay, not more than that. Usually by day 4, day 5, the pain is gone and the muscle soreness is gone, and the athlete start to feel better then. General fatigue, it's either divided into physical and mental, related to the whole training session. And the athlete feels that he is drained out. It's like he cannot train anymore. He's so tired. He's extremely exhausted. He cannot mentally focus on his training. The third type, which is long-term chronic fatigue, related to physiological and psychological stress caused by exhaustion and overtraining. And there's always a narrow margin between training and overtraining. And even most of the professional athlete, they wouldn't, look at exactly when they're going to be extremely fatigued. All their target is to train very hard to reach their target. They want to be a champs, and they are stressed. A lot of stress from the media, from coaches, from teammates and spectators. So there's a huge stress and a big impact on professional athletes. And this is what we call it the tired athlete. And you wouldn't notice that there's a deterioration in his performance. And it can be really devastating if it is not seriously addressed. What are the causes of fatigue? What made the athlete is weird out and he cannot really training in the usual way he's used to? We cannot really say there's a single cause or a single reason involved in the process of fatigue in sports and held to be responsible for it. It is a multifactorial causes which lead to fatigue in athlete performance. It could be due to changes in the internal conditions within the muscle, such as depletion of muscle fuels, depletion of glycogen and creatine phosphate, which are the sources of energy for an athlete to continue his training. It could be due to depletion and shortage of high energy phosphorus compounds as well in the muscle system and musculoskeletal system. It could be due to increase the core body temperature, result later on in dehydration. And when the athlete becomes dehydrated, he loses a lot of fluids and he feels really fatigued, and the muscles are not having enough blood supply and enough oxygen to be redistributed during the training session, and the athlete will feel really fatigued and cannot perform at an optimum level. Also, it could be due to metabolic changes during training, like byproducts such as adenosine diphosphate and cannot be transformed into adenosine triphosphate plus energy production. This could be another factor or another cause responsible for fatigue. When it comes to fuel depletion, we always talk about high intensity, short duration activities, such as pole vault or, short sprinters like 100 meters runners. They rely on, phosphocreatine to fuel the adenosine triphosphate phosphocreatine system. And then when phosphocreatine stores deplete or there's shortage after 10 seconds, and this is what we call it the anaerobic stage of strenuous exercise, or the first 10 seconds, like in 100 meters runners, it depends on the anaerobic stores of energy which are stored in their skeletal muscles and their glycogen, adenosine triphosphate, phosphocreatine system. And if there's shortage in it, definitely it will affect the athlete musculoskeletal ability and his efforts to perform either during training sessions or during special events. The phosphocreatine depletion increase in inorganic phosphates, and this will lead must decrease intensity when phosphocreatine depleted more than 95% of the maximum heart rate for the athlete. Depletion of energy stores is a primary factor with fatigue. There's no doubt about this. And I'm sure that all professional coaches, they know that their training is more scientific, based on a lot of facts that they have to, modulate their training sessions to how can an athlete perform at the best he could, and how can they increase their energy stores. You can use it for training with maximum intensity, and they can meet their maximum heart rates without being fatigued during training sessions or during competitions. Once the adenosine triphosphate phosphocreatine system is exhausted, body start to use glycogen as an energy source, and this glycogen mainly is stored in muscles and in the liver as well. But for athletes, the more glycogen is utilized during training, it's coming always from muscles, being stored in muscles. Less oxygen is available to work on muscles, and then muscles become fatigued, and this is we come to the stage from anaerobic to aerobic exercise or training. Then in this diagram, we see the restoration rates, in this timetable. And if you look at the left side, there's the recovery time in seconds, and on the right side, the muscle phosphagen restored. In 30 seconds training, there's 50% of muscle phosphagen restored. This is a recovery rate for 50%. For 75%, it takes 60 seconds, and 93% muscle phosphagen restored again, it needs 120 seconds recovery time. 97% needs 150 seconds. 98% needs 180 seconds. 100% needs at least 10 minutes, if not more. Here, there is a comparison between aerobic and anaerobic glycolysis, which is, I make it really simple to be understandable. In anaerobic, glycolysis, aerobic glycolysis means the existence of oxygen. The glycogen break down into glucose, and there's further breakdown of glucose into pyruvic acid. And with available sufficient oxygen, this pyruvic acid will be transformed into carbon dioxide. This is the end product. Carbon dioxide, then water, which is H2O, plus which adenosine triphosphate. And this is what we really care about. Adenosine triphosphate is a source of energy, which is an athlete badly needed for hard and efficient training. If you go to the other side, the anaerobic glycolysis, we can see that the glycogen break down into glucose, and glucose will further break down into pyruvic acid. In the existence of non-sufficient oxygen, this pyruvic acid, instead of producing carbon dioxide and adenosine triphosphate, it produces lactic acid and hydrogen ions and adenosine triphosphate. So the difference between aerobic and anaerobic, that the end metabolic product in aerobic is carbon dioxide plus water plus adenosine triphosphate, but in anaerobic is lactic acid, which will be held responsible for muscle fatigue. And we will focus more on lactic acid in the coming slides to show what's happened. The objectives of recovery is to restore functions, to come back to the normal conditions which the athlete was in before training. This is the first priority. The second is neuromuscular recovery, and tissue repair as well, plus resolution of muscle soreness and psychological recovery from the burden of exercise. Next, please. So during recovery, the body overcompensates for the stress placed on it, and adaptation results. And the principle of recovery states, in order to maximize performance, of any athlete to maximize his performance and his physical fitness benefits, an athlete must recover adequately from the previous training stimulus before the next stimulus or the next training it is introduced. Okay? An athlete, you do not expect him to perform at his best if he's not making a good recovery from previous training. All athletes need different recovery strategies. And this strategy is reliable and determined by the type of training undertaken, the intensity of training, and duration of training. And those factors are really crucial for, to tailor the strategy of recovery for each individual athlete or for a group of athletes. Recovery strategies as part of training session, passive and or active recovery, and stretching. This is very important. So recovery could be passive and active, or passive and or active recovery together with proper stretching. Replenishment of fuels, carbohydrates, you know, because recovery is not only relying on, different kind of massage, dehydration. It depends also on how much carbohydrate loading you're having in your body, plus replenishment of fluids and electrolytes, which be must during training sessions or competitions. Hydrotherapy as well, is very important for recovery strategy, like cryotherapy, ice bath, pool sessions. Therapeutic massage is also a crucial factor and play a significant role in recovery strategy. Hyperbaric chamber with 100% pure oxygen, you know, I know it's very costly, but, athlete, there's a big investment in sports, so they need it. It's more to fatigue muscle to increase recovery rate and to enhance recovery. Also, we cannot ignore psychological techniques like progressive muscle relaxation, meditation, breathing techniques, and mental immersion. How to cool down an athlete after training? Simply by passive rest, but not for a long time. It will replenish creatine, creatinine phosphorus stores most rapidly. Okay, but an athlete, they don't long duration. They don't need long duration time of for rest, Stretching to prevent delayed onset muscle soreness. Proper stretching, either active or passive, you know. Proper, proprioceptive neuromuscular facilitation technique and static stretching as part of cool down while muscles are still warm. That means it's after training session right away. This is what we do. Cool down could be between 10 to 15 minutes or 15 to 20 minutes maximum. Active recovery removes lactate. You have to get rid of the end product of anaerobic exercise, which is lactic acids. Within 1 to 5 minutes with low intensity exercise, less than 70% with heart rate maximum to maintain high oxygen levels required to break down lactate. And this prevents venous pooling and at the same time will increase venous return going back to the heart. So the cardiac output will be more efficient. And this is like, see some athletes, cooling down and doing some stretching after exercise training or after session, like in soccer. If we talk about hydrotherapy for recovery, it is really important, and it is like we rely on it to a great extent to increase performance and to enhance recovery. Simply, an athlete can take hot, cold shower. You take a hot shower first and then end with cold one. This will lead to vasoconstrictions. This will lead to narrowing of the blood vessels by using cold shower, and then vasodilatation. The blood vessels will widen and more blood will be pulling through the blood vessels by a hot shower, and this will cause a blood shunt effect in the blood vessels, which is speed up removal of metabolites. And this is like the same mechanism when you use ice for acute sports injuries. Another thing, like you can use pool sessions, usually next day as a recovery session for 20 to 30 minutes due to reduce stress of weight bearing on joints. We all know that in pool sessions, there's no weight bearing on joints, which is very effective and very good as well. Cryotherapy is also important, like immersion in cold water, such as ice bath, but taking precautions for those who are having like sensitive to ice bath, those who are having phobia, we have to be careful with that. And plus, those who are some of the athletes, they might have like pacemakers in their hearts, so we have to avoid cryotherapy, or they can have only for the lower part of the body. Okay, and this will reduce the swelling caused by soft tissue damage during exercise, high occlusion sports, and where repetitive action causes muscle microtrauma. So cryotherapy is perfect for such kind of recovery. Deep water running as well, we can use it to speed up recovery. Okay, deep water run. We can use also ice bath for athletes. I've seen this in Scandinavian countries, in Finland, but they are used to cold weather. We cannot try this for athletes who train in hot countries because they are used to this. We come to massage as an effective way for recovery. The benefits of massage are quite obvious to everyone, because all of us, we experience sports massage is very important for athletes. Massage stimulates increased blood flow, which increase oxygen delivery to muscles and also increase removal of metabolites. Massage also relax muscles and reduce muscle tightness and improve joint movement. Massage break down scar tissue. Scar tissue results from heavy training and strenuous exercise. And this will assist muscle repair. And massage improves significantly and relieve swelling. Okay? But you need an expert masseur. He knows how to perform massage because there's so different kind of massage. Okay? And so different schools of therapeutic massage for athletes. Progressive muscle relaxation, tensing and relaxing muscles, and definitely enable athlete to understand the difference between tensing and relaxing muscles. So, for example, you have to isolate one muscle group and create tension. This one for like when you do progressive muscle relaxation, like improper receptive neuromuscular facilitation technique. Say, for example, you have a muscle fatigue in your hamstring muscles. Okay, so you do stretching for hamstring muscles and you do stretching for the opposite muscles, the quads muscles. And this is what we call proprioceptive neuromuscular facilitation technique. By stretching some muscles passively by the therapeutic athlete assistant, so the opponent muscles will be relaxed. Okay? And this develops skills to release tension and resulting in decreased muscle soreness and muscle tension as well. Some of the professionals, medical teams sometimes use compression garments like clothing, and claim this kind of compression clothing claim to accelerate recovery by increasing venous return and reduce exercise-induced muscle damage, and also accelerate recovery process, remove lactic acid faster, increases muscle oxygenation, and improve body temperature control. However, we have to be very careful in using it, as it shows in the coming up slide, that this kind of compression garments could be damaging for some of the athletes, especially in hot climate and hot weather, because it makes you sweat a lot and lose a lot of fluids, and you might become really exhausted and dehydrated. Okay? So we have to be careful with this. Immediately after exercise, what we should do is we have to replenishment of fuels and replacement of the fluids being lost, and the kind of fluid carbohydrate stores as well. We have to refill these stores, because like for example, if an athlete finish exercise or training at 5 o'clock p.m. and he eat after 2-3 hours, this is not really effective, and he's not going to benefit from this. He has to have a meal within the first hour after training. The earliest he will have a meal, the earliest he will benefit from this. So if you during training you lose a lot of carbohydrate stores by so you have to consume at least, 5 to 100 gram, give you fast source of glucose within 5 minutes after you finish exercise, like chocolate bar, jelly beans, crumbles with honey, a jam sandwich, as soon as you finish training. So you have to consume carbohydrates and protein together, and the percentage is 4-1 to replace the carbohydrates and proteins you have really used during exercise. Glycogen replenishment over the next 2 hours, athletes should consume 225 to 50 gram carbohydrate every 15 minutes. This maintains high insulin levels. And these high insulin levels, don't be scared that it will act on glucose and the blood glucose will go down and the athlete will feel fainted or this and that. No, because the glycogen stores in the body muscles and liver will be transformed into glucose as well. And this insulin will uh, help in storing these carbohydrates in your muscles, which you will use it in the following exercise. After 2 hours, carbohydrate consumption should continue at a rate of 50 gram every 2 hours for 24 hours. It can take up to 24 to 48 hours to fully replenish carbohydrates. So that's why we always advise the athlete to eat as fast as possible after training, within the first hour after training. Post-event glycogen intake, which will lead to high glucose index within the first hour, is 55% restored in the next 5 hours and 100% restored within 24 hours. If the athlete take meals within 1 to 2 hours, 100% restored within 24 to 48 hours. So it takes much longer. And if an athlete eat 5 hours after finished training, this will take up to 5 days. So you see the consequences of late eating after exercise. It's not good for an athlete. The role of protein for recovery: protein is broken down following intense exercise. So you have to compensate the protein is being used during exercise. So the addition of protein to carbohydrate amplifies the insulin response and promotes increased glucose delivery to the depleted cells and depleted muscles. Insulin, in fact, stimulates protein synthesis as well and helps reduce protein breakdown, which assists in the growth and repair of muscle tissues which have been damaged during exercise. Hydration is very important, is assisting fluid requirements. And it simply can calculate this by weighing your athlete before and after training. And the decrease in body weight after training, this is what is meant to be compensated by giving him fluids that he's been losing during training. 1 kilogram of weight lost is 1 liter of fluid lost. Almost 1 to 1.5 liters of fluid required for the athlete to replace the fluid being lost during training. Aim to drink similar amount of fluid in future training and competition to prevent dehydration. Because dehydration can affect the athlete performance, his muscles will become fatigued, and he will be under mental stress as well, and mentally he will be confused. So dehydration is very dangerous for an athlete. Dehydration, I mean. Hydration during events, 250 isotonic sports drinks every 15 minutes. There's a sports drinks and is allowed and is not prohibited by WADA, a lower doping organization. Isotonic similar to blood composition. Hypertonic is got more sugar, and hypertonic is got less sugar. So we always advise athletes to have isotonic, which is similar to blood composition. Sports drinks as well is important as long as they are allowed and they are not considered to be doping. It contains carbohydrate and electrolytes and flavoring, making it easier to drink and easy to be absorbed. Okay, so sports drinks are important. It contains sodium, which aids in retention of fluid without stopping thirst mechanism. It aids in replenishment of glycogen, and so athlete must consume 500 to 1,000 milli per hour of isotonic drinks at the end to compensate for the fluids being lost during strenuous exercise. Sports drinks are easily digested and easily emptied from stomach faster than water if carbohydrate content is between 6 to 8%. It occurs when fluid loss excess fluid intake. Effects of sports drink include or dehydration. The dehydration include the effects of dehydration, mental meltdown, decreased reaction time. The reaction time of the athlete will be delayed. His concentration and decision making will be significantly affected if he's dehydrated. His body temperature core is elevated, and this will lead to increased blood redistributed to the skin in an effort to cool down, and this will make the athlete more exhausted. It also decreases blood to muscle and decrease oxygen available and increase reliance on the lactic acid system and hydrogen ion accumulation, and this will result in fatigue. Blood becomes thickened and harder to pump, less blood delivered to the muscle, and decreased amount of oxygen available for aerobic glycolysis and to oxidize lactic acid. What is the key message to take home when it comes to recovery? Recovery is an integral component of overall training program. So it is very vital and very significant for athletes. Recovery is essential for optimal performance and improvement. Recovery also have understanding the physiological concept of recovery is essential for designing optimal training program. So recovery must be stressed on for our athletes to reach the performance and the target which we want them to achieve in their sports professional life. Thank you so much. I hope we all benefit from this concise topic about fatigue and recovery.
That was an excellent presentation, doctor. Hey, I had a couple questions with it regards to the swimmers. Because we're in the water, it seems like that's less punishing than being on land. So that maybe the fatigue factor, this recovery can happen a little bit quicker.
Correct. Yeah, this is really correct. Swimming has a less impact on athlete compared to other sports. However, it depends of what kind of swimming events, what kind of swimming. Like in short swimmers, you don't have this kind of impact of exercise on the muscles compared to long distance swimmers, as far as I'm concerned.
Yeah. And then another question was in different sports, like the ball sports or the throwing sports, or maybe a shot put, or where there's equipment involved. Does that impact the recovery? Like in baseball or maybe cricket, where the pitchers are throwing a lot, then they seem to always have more necessary time for recovery. Or what about team handball that you're involved with, if there's a lot of throwing involved?
Well, it's there's other games as well with throwing involved, like handball and other games as well. I do agree that, and that they need much more attention to be paid for recovery. Plus, if you do a proper warming up before exercise or before official matches and competitions, and if we do a proper cool down together with efficient training before being involved in training or competition events, this will also enhance recovery and make it quite possible to be more easier than supposed to be. This is one thing. The other thing is also nutrition is very important and very significant. I mean, the kind of food they're eating, the proper food they're eating, when they should eat, what amount of food they should be eating, and their food habits must be tailored according to training sessions and the duration of training and intensity of training as well. Plus, one more thing, sleeping habits as well. They are all involved in the story of recovery for sports. And if the equipments are involved in sports, so I think and I believe that ice therapy and massage playing significant role in such kind of sports.
Very good. I have another question. What about aspirin or Aleve or some type of painkiller, over the counter stuff? Do you think some of that helps with the stop the swelling or buffering? Or what's your opinion on those types of drugs?
And we always in the sports medicine or in medicine in general, we always go by evidence-based medicine. Okay, I don't know if you agree with me or not. Hmm. I mean, it used to be, and still, some athletes, based on medical advice or non-medical advice, they use aspirin, which is acetyl salicylic acid, as a blood thinner, and they believe that this will enhance the blood thinning and increase the blood supply to the musculoskeletal system and will help them out to perform well during, especially during events. But there is cons and pros with everything. Like if you use aspirin, if you use it in an excessive dose, there's serious side effects and consequences like bleeding, stomach ulcer. Okay, he might feel hypotension, things like that, or he might feel heartburn, which could be troubling for him during exercise.
Yeah, I was
Uh,
wondering after a giant competition if there was like a marathon runner or a triathlete, or after a big event that happens maybe only once a month, if it would be good to have something to help reduce the swelling, like a bufferin or something. I don't know the drug, so I was wondering what you thought.
in drugs or medicine,
Yeah.
usually after a marathon or things like that, we uh, we are experienced enough not to use medications because it could have serious consequences on the athlete. But the best thing is we use for a marathon. The most critical issue is dehydration. So, but as you know more than me, as an experienced coach, that during marathon they keep on giving them by the side tracks, they're giving them fluids during marathon, and after that, after they finish, give them plenty of fluids. Plus, they use cryotherapy and proper massage and proper meal afterwards, and this will all an add-on for fast and safe recovery.
Cryotherapy is something that was interesting. We did a discussion of a young boy suffered a drowning incident and was into the hospital, but they used the hyperbaric chambers. Is that part? Have you ever had experience with that? Could you?
Yeah, I had experience in Al Hilal Club with a football team. Yes. But, in Saudi Arabia, the weather is really, really hot, But some of the foreign players, which are signed by football club in Al Hilal, they are used to hyperbaric oxygen or cryotherapy room. And I tried it by myself before I use it for athlete. Anyway, there's precautions. You have to uh, use it, or you have to pay attention to it. First of all, those players they have prior to any training or prior to be trained, they have a medical checkup, complete medical checkup. I mean, especially for the heart. Like they have echocardiography, and they have cardiac stress test as well. So we have to make sure that they have no underlying cardiac problems. This is very important. Plus, we have to make sure that whether or not they are sensitive to cryotherapy or not. Because if they never tried it before, we cannot just go for a cryotherapy room for 1 to 3 minutes with a temperature below zero. They could suffer from shock and blood shunting, and they could suffer from serious consequences. So there is rules for it. We have to follow rules strictly. It is very effective, but believe me, it's debatable because there was always a debate in professional sports whether or not hydrotherapy is effective for recovery or not. But anyway, I strongly recommend that recovery is not reliable only on one element. You have to use all the keys you have with you to enhance the recovery, like massage, proper meal after training session, hydrotherapy like shower room, ice tanks. You can use it. You can use pool therapy as well. So you have to use all methods of recovery. Proper stretching is very important as well. Limited periods of passive rest as well. So you have to use all the elements. It will help the athlete. There is no one single reliable element you can use for professional athletes. This is my experience.